So good afternoon. Thank you for coming to this press conference. Just wanted to make an announcement and make a release that is good news for GMH. On January 12th, a Norwegian company, which is what we contract for from CMS to do the whole Medicare rebasing request, and it was approved. So effective immediately, we are going to, or the money is already in the account.
Yes.
We have about $6.3 million from CMS, which is the adjustments that were made for Medicare reimbursement that is targeted from 2014 to 2015 to 2016. And as a result of this rebasing that was approved by CMS, we'll be also expecting additional $6.3 million moving forward. And then as we continue on with the current Medicare rebased rates, we'll be able to get more reimbursement for our Medicare patients from 2019 and moving forward. So I just wanted to thank the staff of the Guam Memorial Hospital, especially key people like Benita Manglotnia, who has been working very closely with CMS to get this approved. This is an issue that we've been working for the last 20 years because the Medicare rates were being pegged at, I think, 1998. So what this does is it really reimburses us for the cost that we are incurring now for Medicare patients, which is an added cost, but we were at a reimbursement rate of 1998. So I have Lilia Posadas here too. She's the acting administrator of the Guam Memorial Hospital, and if you have any questions, she could probably help answer the questions also.
Just to be clear about this, this is a permanent rebasing.
Yes.
Right?
For those years of 2014, 15, and 16. For this year, 2019, those target rates have been adjusted again at a higher reimbursement rate.
And are we to understand that this is essentially an increase of the Medicare per diem rate, which was at what, 1,300?
The per diem rate is a different rate.
So this is
a per day rate.
This is a per
that
just
hasn't
for the whole year, as far as the cost report that we submitted, this rate is per patient per discharge.
But yes, the per diem rate is also going to change.
Oh, wow.
Yeah.
Yes.
Well, that's been confirmed?
Not yet, but we are anticipating that the target date is April, where the per diem rate right now is $1,300 as of October. As for April, it will go up to $1,900 per day per patient.
Confirmed.
I haven't received the confirmation, but I have received communication that that is the proposed rate.
And do you know,
Yes, sir.
will this affect GMH's current standing with CMS? We know that they were pending review from the last inspection.
This doesn't affect.
No.
It doesn't. This is just the reimbursement for the services that we provide for Medicare beneficiaries. CMS surveyors looking at our processes and the services that we provide, that's a different process, a totally different entity. But you know, they come here to validate that whatever services we provide are within the standards, within the conditions of participation for Medicare.
Can we get a copy of the letter that you received from CMS advising you of this change?
I will get that to you. Right now I don't have it with me. It was communicated to our CFO, Benita. Yeah.
And does this mean that Benita will stay on?
Well,
you indicated that she's been working on this for a long time. I
Yes.
understand her contract expires sometime this
Her
month.
contract has expired. We are going to ask her to do a month-to-month right now. But this doesn't necessarily mean that she will stay on.
Okay. I'm confused, and I think that the public is confused as well, so hopefully you can give us a little education on the difference between this per diem rate, which has been a headache for 20 years as well, and was at what, 1,000?
Right now, as of October, it went up to 1,300
1,300
per day, correct.
And it couldn't be increased because records were lost back in the 90s. So what's the difference between that daily Medicare reimbursement rate, and this?
It's based on the cost report that for the prior year, collectively, all those patients that were in the hospital, and upon discharge, this is the rate that Medicare will reimburse the hospital per patient per discharge, collectively for the year. The per diem is when the patient is in the hospital for 5 days, Medicare reimburses the hospital the $1,300 per diem rate per day that beneficiary is in the hospital.
And that's
So
what's
there's
still
a
pending.
discharge rate and a per diem.
Right. Two different
And the
rates.
per diem is still pending, but you're hopeful.
Still pending that effective April, it will go up to $1,600 per day.
1,900.
Did I say 1,900?
Yes.
No, $1,600.
Okay.
Yes.
1,600.
Yes, $1,600 per day.
Now, this $6 million from CMS covers the period between 2014 and 2016, right?
2014, 15, and 16, correct.
16.
So it's $6 billion per each of those years?
Collectively, for those 3 years, the difference of what that rate before and then how it was adjusted for 2014, 15, and 16, collectively, it came out to be $6.3 million.
Total.
But moving
Collectively.
forward,
And moving forward, because again, this year, that rebase rate, that target rate per discharge has been adjusted.
okay. And
So we have that opportunity again to.
So every year it gets adjusted.
Adjusted.
Right.
So 2019 is it's 9,115, I think, and then 2020 will be probably readjusted also. But the point there is that we have been approved
Correct.
to be calculated based on the rebase.
And you got this news in January?
We got the
12.
news in January that we were approved.
Yeah. Why did you wait until now?
Because
This sounds like great.
They
We wanna
just
see the
gave the
money.
money.
We want to see the
So
money.
the money's in the bank now?
The money's in the bank,
Today.
correct. As of, yes, at the 7th, this morning.
So you didn't want to count your chickens before the
Right,
exit?
exactly. We want to see the money first.
Well, so what does this mean for the hospital? This sounds like.
I think it means that we could probably pay down our payables, use the money to pay down our payables, to buy supplies. It's added revenues for the operations of our hospital.
What are the payables at now?
Either $9 million, something like that.
So to bring it down to $3 million and
Yeah.
hope for more in the future.
Right, exactly.
But
Any
congratulations. I mean,
Yeah,
you get-
congratulations.
Thank you.
Good news
It's
Yeah.
Great.
Big
for
news.
our quality of healthcare.
Correct.
Thank you.
Any other questions?
Lillian, any updates from CMS surveyors in the meantime?
They did their exit conference this morning at 9 o'clock, and basically what they came for was a revisit of last year's survey. So and I was advised I cannot really disclose a whole lot because what they shared with us are still preliminary. When they submit their report in 10 days to the Region 9 main office, it could change. So that's why, again, I cannot disclose a whole lot, but otherwise, from the previous year, they cited us in 7 conditions. It dropped down.
Any comments?
You
on
can't say
the-
anything
I
further.
can't say a whole
So
lot.
the citations are fewer
Lower.
this time.
It seemed like they were pleased when they left. then.
They're very pleased because they see that the hospital has really made great strides to improve the process and the care that we provide.
You know,
Any
GRMC
comments on
announced theirs
Senator
last
Talati's?
Friday. Are you not able to?
Sorry.
You're not able to, GRMC announced their results last Friday.
Well, but we were advised by the surveyors that we cannot really disclose it.
And the reason for that is there's still some maybe details
Mhm.
that they're working through, and there could be some changes.
Correct, and that's what they said.
Any comments on Senator Talati's measures that she introduced to borrow or to get Section 30 money allocated to the hospital?
Any progress?
Or,
Comments
do you have
about
any comments regarding that?
You know, I haven't really seen the bill, but I know that some of that money that she's looking at was to actually help pay possible shortage of Medicaid by the end of the fiscal year. So that I do know through the Department of Public Health and Social Services that Medicaid's monies might be having a shortfall. So Senator Talai is looking at projecting for the end of the fiscal year.
Does this?
I'm not too sure what the other issues are.
That was basically it. She was trying to, I think there was a projected 16 million
Yeah.
shortfall that she was attempting to get the Section 30 funds allocated to. Will this increase in the per diem, do you see it helping with Medicaid or Medicare payments going forward? Because while we do have a shortfall now, will this help?
I think this rebasing will also affect and apply to Medicaid Medicaid payments.
Okay.
Yes. Yeah.
Thank you, ladies and gentlemen.
Can you just clarify one thing? What's the difference between reimbursement and rebasement?
Reimbursement and what?
And rebasement. The rebasement.
Rebase, it's defined as a target rate per patient per discharge. Reimbursement is what we get then from Medicare.
Reimbursement is a one-time, rebasement is permanent?
No, rebasement again, because it keeps getting adjusted every year, so that's not permanent.
Okay.
I think rebasement is probably the methodology of getting to your rate per diem.
Right.
Yeah.
I don't understand.
So,
You know, you have a base, and then you calculate the cost of providing Medicare services, and that the cost may be higher than what that base is, so they rebase it for the next year. That's how I.
Right, they adjust.
there's a formula. It's a very technical formula.
It's
Right.
an adjustment,
Yeah.
It's like a
basically.
market,
It's a very technical formula.
Right, based on market
market,
index,
it's like a
right.
market adjustment.
Mhm.
But when things get rebased, they don't go down, right? I mean, if you're,
I
it's an
would think
increase.
so,
Right,
yes.
exactly.
Less healthcare
As long as cost for healthcare continues to increase, which I have never seen it decrease in all my many years in healthcare, so, yeah.
All right. Thank you, guys.
Thank you.
Thank you.